Exposure to lead can lead to all sorts of side effects like reductions in IQ scores, damage to the kidneys, heart and brain, infertility, and even violent tendencies. To reduce lead exposure in South Africa, government started phasing out the use of lead in petrol starting in 2006. And come next year, a new set of rules around lead paint will also come into effect. For more on this, we're joined by Rico Euripidou. He's an environmental health scientist and campaigner with Groundwork. Rico, thank you so much for joining us. The World Health Organization has pinpointed lead as one of the chemicals that really cause damage and that they're fighting to get rid of. Tell us just how bad lead is. Not many people might know just how bad it is for the human body.
Good morning to you and your viewers. Yeah, well, let's begin with the absolute biological fundamental. Lead has no biological function in your body. In fact, any lead in your body, and even very, very small amounts of lead in your body, can cause significant harm. So the harm that we observe is normally in low-income settings, where children and the most vulnerable children, the poorest children, are generally affected. And we see this through the objective measure of blood lead measurements in their bodies. So we know that now that we've phased out lead in petrol, we still observe blood lead levels in children that can still cause harm. And I'll talk a little bit more about the harm in a moment. So the reason why we think that blood lead is still high among these children, among these vulnerable children, is because we still have lead levels in paint. And it's not just the paint that we buy and we use from today, it's also the legacy paint. In the past, a lot of lead was added to paint to give it different kind of structural flexibility, to make it more durable, to make it anti-corrosive, to give it color for fixing purposes, etc. And we still see that legacy still playing out in the poorest communities. So in inner city neighborhoods in Johannesburg, where park equipment was painted with legacy high lead level paint, we still observe those lead levels in the soil where the paint is degraded, and young children, being who they are, they spend a lot of time close to the ground. They have a lot of kind of hand-to-mouth activities, and that increases their blood lead levels. And the particular reason why we are worried about children is because it affects their IQ and it affects their development, especially when they are young. And we know that then that has a huge, massive societal cost. It costs us further down the line because we have to spend more money looking after the kids. We have to have special care for them. We have to be able to deal with their disabilities, and those disabilities last throughout their lifetimes.
Rico, so these new regulations that the Ministry of Health has put forward, what exactly will they achieve and how will they be policed?
So it's part of a global initiative. There is a global alliance to eliminate lead in paint. It is jointly administered by the World Health Organization and by the United Nations Environment Program, in recognition that globally lead in paint is a problem, that lead in paint travels globally. It's sold from one jurisdiction to another, and that there are many countries that don't have regulations. There are over 100 countries around the world that don't have sufficient regulations in order to address this problem. So what this global initiative does is it advises countries and work with countries to help them set a minimum level of lead in paint, because it's so difficult to get rid of all the contamination, and you don't want to set something that is feasibly unachievable. You want to set an achievable level. So the level that is recommended by this global partnership is 90 parts per million, which if you had to weigh the paint by volume, that would be about 0.0009% of lead in the paint that is permissible. So that's the first step, is set a low benchmark. The second step is work with the manufacturers, work with the people who import and distribute paint, and raise their awareness so that they understand why they're doing it. So it's put into context. The third is to have these multi-stakeholder, multi-sectoral approaches where you involve civil society, the National Department of Health, your premier research councils like our Medical Research Council. Professor Angie Mathieu is a leading expert on lead in paint, and she leads the group that researchers lead in blood lead levels in our children. So you have these broad coalitions of government, civil society, and research institutions bringing together the science policy interface together. And once you have that buy-in, then you work to systematically reduce the levels in paint over time. So you give people time to comply with the law. You help them understand how to test for the paint. So you have third-party independent testing so that, we have credibility in the system. And systematically, we work towards eliminating lead in paint and protecting our children.
Well, a global problem, and I'm glad that South Africa has taken a step in the right direction. Thank you so much, Rico, for your time. Rico Euripidou joining us to discuss the brand new regulations announced by the Ministry of Health that will come into effect next year. He's an environmental health scientist and a campaigner with Groundwork.